Hello beautiful mamas, welcome back to my channel. I am Nurse Nello. If this is your first pregnancy, your second pregnancy, or even your fifth pregnancy, there are 3 things you must know in order for you to have a safer and more informed pregnancy journey. Now this information is here to help you make the right decisions and make them at the right time. Number 3 is very important, and I want you to stay tuned and watch to the end. Like I would always say, what you know you can better control. Stay tuned. One very important information pregnant women should learn is to know about the placenta. Learn extensively about your placenta and how it works. Now, most people hardly learn about the placenta because they see it as a waste product. Once the baby is born, placenta will be discarded. But the role of the placenta during pregnancy can never be overemphasized. Now, the placenta has a major role to play. It helps in oxygenation, transfers oxygen from the mother to the baby. It helps to supply nutrients from the mother's bloodstream to the baby, helps to filter waste products from the baby. It helps to protect the baby from external harm. That is the function of the placenta. But there are some issues that can come up with the placenta that, if not properly handled, can cause harm to the pregnancy. Now, the placenta can be positioned anteriorly or posteriorly. Anteriorly means to be facing the uterus. Posteriorly means to be backing the uterus. Now, if you go for ultrasound and they say your placenta is anterior, it means it is facing the uterus. The only difference is that you may not feel the baby's kick as much as the placenta is posterior, but it doesn't harm you at all. Whether anterior placenta or posterior placenta, your baby will be fine. Now, there are some issues that may arise with the placenta that needs to be handled immediately. Issues like placentaprevia and placenta abruptio, whereby the placenta leaves the upper segment and moves to the lower segment, blocking the cervical os, thereby leading to bleeding. It can cause a lot of bleeding and even inhibit vaginal delivery. Placenta abruptio is when the placenta detaches from the wall of the uterus and causes a lot of bleeding. This is an emergency situation and the baby needs to be delivered via cesarean section to save the mother and the baby. The only way you will learn about the position and the health of the placenta is when you go for ultrasound. Around 20 weeks, if you go for your 20 weeks ultrasound, that's when the placenta is fully formed. You will now know the position of the placenta and to know if the blood vessels are well placed. Sometimes the blood vessels are not well placed. It can cause some variations in the placenta, but that doesn't mean that it's going to harm you or the baby. Now, going for your 3rd trimester scan will also help to know if the placenta is at the upper segment or the lower segment. So learning about your placenta is one important information you need to know because it will impact your pregnancy a great deal. Okay? Another very important information every pregnant woman should learn is about cervical examination and pelvic examination. Learning about your cervix and your pelvis will also impact your pregnancy a great deal. Now, the cervix is the doorway between the uterus and the vagina, while the pelvis is that bone that harbors all the reproductive organs. It plays a major role. Now, some women have short cervix, some have incompetent cervix or weak cervix. Now, this can really impact your pregnancy. Weakness of the cervix can lead to recurrent miscarriages if not properly handled. Now, if your cervix is short, you need to work closer with your healthcare provider. If you have a weak cervix, they have to do cervical cerclage. They will stitch the cervix to protect the baby and loosen it around 36 or 37 weeks of pregnancy so that you can have vaginal delivery. Learning about the type of cervix you have will really impact your pregnancy. The pelvis, on the other hand, are 4 in number. We have the gynecoid pelvis, platypeloid, anthropoid, and android. The only type of pelvis that supports vaginal delivery is the gynecoid pelvis. Other types of pelvis may be difficult to deliver vaginally, so she will have to go for cesarean section. So learning about your pelvis and your cervix helps a lot to determine the outcome of your pregnancy if you're going for vaginal birth or not. This is an important information. If you have not done cervical examination or pelvic examination, please book a section and do it now. Okay? The 3rd information and the most important information every pregnant woman should take seriously is when to seek help. This is important. A lot of pregnancies, a lot of complications have been avoided because someone called earlier, and a lot of complications have not been avoided because someone called late. So please seek help. Whenever something is not going as usual, whenever you feel different from how you used to, call for help. Pregnancy is delicate. It's not something you just sit at home and assume that you are fine. You are not fine. Go to the hospital. It's better for you to go to the hospital and they tell you you are doing okay, oh, don't worry, than for you to stay at home, assume, and have regrets at the end of the day. Now, what are the signs that will tell you that you need help? What are the signs that will tell you to call 911 or go to the hospital immediately? Is number one, when you're having vaginal bleeding, especially second trimester and third trimester. Believe me, no bleeding in pregnancy is normal. At any stage of your pregnancy, bleeding is abnormal. Make sure you go to the hospital. When you have blood vision or severe headache, the headache is so much that you can't stand, you can't see, you're having photosensitivity, you can't even stand up, your gait, your balance is compromised, please call 911 or go to the hospital as much as you can. Another reason is when you have swollen legs, swollen feet, or your eyes are swollen all of a sudden, or begin to have rashes all over your body, please call for help. When you start having severe abdominal pain, not the early pregnancy cramp that is normal, no, but severe abdominal pain, please call the hospital. Or your baby is not moving, the movement of the baby reduced, you have counted 10 kicks within 1 hour or 2 hours and the baby is not moving, please go to the hospital. It's an emergency. Or when your temperature is very high, above 39.5, you're getting so, your body is so hot, you're so weak, you can't even get out of bed. As a pregnant woman, that is an emergency. Go to the hospital. All right? Or when you start having leakage of water, all of a sudden you start leaking water, you are not 38 weeks, you're not 37 weeks pregnant, but you're seeing water running as pouring down from your private part. Go to the hospital. It is an emergency. Most times we women, we overlook these signs and at the end of the day we have regrets. Please report, and report at the right time. Okay? Now, one thing I want to remind you is do not allow anybody dismiss your feeling, dismiss how you feel. When you go to the hospital, explain to them how you're feeling. Don't allow anyone dismiss it. Let them attend to you according to how you're feeling. It is your right as a patient. Remember that. Remember that these tips are here to help you navigate through your pregnancy. Now tell me, which of them surprised you? Do you know about the placenta or the cervix, or have you called for help at any point in your pregnancy? Drop in the comment section. Now, if you want to know the signs of labor, if you're in your third trimester and you want to learn about the signs of labor, I have a video on learning about the signs of labor. Do well to click that video and watch. My name is Nurse Nello. I'm a nurse and a midwife, and all I do in this channel is to share healthy pregnancy, postpartum, and fertility tips to all my beautiful mamas. Do well to subscribe to my YouTube channel. Turn on notification bells so you'll be the first to see all my videos. All right, thanks for watching this video. Don't forget to like, share, and drop your comments in the comment section. Okay, see you in my next video.